Have you ever woken up in the middle of the night because your mouth felt so dry that you couldn't swallow? Or reached for a glass of water before your feet even touched the floor? Maybe you've noticed your lips feel sticky, your tongue feels rough, or you need to sip water several times before you can even speak comfortably. Most people shrug it off. It's probably because I didn't drink enough water. I'm just getting older. It's no big deal. But what if your dry mouth isn't just a minor inconvenience? What if it's one of the earliest clues that your body is trying to tell you something important? It could be a side effect of a medication you're taking. It could be a sign that you're sleeping with your mouth open. It might be related to your blood sugar, your breathing during sleep, or even a health condition that hasn't been diagnosed yet. The surprising part is that your mouth is often one of the first places where these problems begin to show themselves. And because the symptoms seem so small, many people ignore them for months or even years. Today, I'm going to explain 9 hidden warning signs that waking up with a dry mouth could be trying to tell you. Some are simple and easy to fix. Others deserve a conversation with your doctor. And the last warning sign is one that dentists often notice long before patients realize anything is wrong. So, if you're over 60 and you've been waking up with a dry mouth more often than you used to, this is a video you won't want to miss. Why saliva is more important than most people realize. Before we talk about the warning signs, let's spend a minute understanding why saliva matters. Most people think saliva is simply there to keep your mouth wet, but that's only a small part of its job. I like to think of saliva as your body's overnight security team. While you're asleep, it's quietly working behind the scenes. It's washing away harmful bacteria, helping protect your teeth, keeping the delicate tissues inside your mouth healthy, making swallowing easier, and beginning the first stage of digestion before food even reaches your stomach. In fact, your saliva contains natural substances that help control bacteria and protect your mouth from damage. When your mouth stays dry for hours every night, that protection becomes weaker. Think about watering a garden. If the soil stays moist, plants remain healthy. But if the ground becomes dry day after day, the plants begin to struggle. Your mouth works in much the same way. Without enough saliva, your teeth, gums, tongue, and even your overall health may begin to suffer over time. I'm Dr. Richard, and on this channel, I help adults over 60 understand the science of healthy aging using practical research-based advice that's easy to understand and apply in everyday life. Now let's look at the first warning sign. Warning sign number 1. You're becoming dehydrated more easily. Let's start with the most obvious possibility. Dehydration. But here's something many older adults don't realize. As we age, our sense of thirst naturally becomes less reliable. That means your body may already need water before you actually feel thirsty. Research has shown that older adults are more likely to experience mild dehydration because the body's thirst response gradually declines with age. You might think you're drinking enough, but your body may be telling a different story. Along with a dry mouth, you might notice dry lips, dark yellow urine, headaches, feeling dizzy when standing up, fatigue, muscle cramps. One of my patients, George, who had just turned 71, kept waking up every morning with an extremely dry mouth. He assumed something serious was wrong. When we reviewed his daily routine, we discovered he drank several cups of coffee throughout the day, but very little plain water. He also stopped drinking fluids after dinner because he didn't want to wake up during the night to use the bathroom. After making a few simple adjustments, drinking water consistently throughout the day while avoiding large amounts just before bedtime, his morning dry mouth improved significantly. Sometimes the explanation is straightforward, but not always. That's why we need to keep looking. Warning sign number 2, your medications may be drying out your mouth. This is one of the biggest causes of dry mouth after 60, and it's often overlooked. Did you know that more than 500 medications list dry mouth as a possible side effect? That number surprises almost everyone. Some of the most common include medications for high blood pressure, allergies, depression, anxiety, overactive bladder, chronic pain. Now, here's the part many people don't know. Sometimes it isn't one medication causing the problem. It's several medications working together. Imagine each medicine lowers your saliva production just a little. By itself, you might never notice. But when several medications have the same effect, the dryness can become much more noticeable. Doctors sometimes refer to this as the combined anticholinergic burden, but you don't need to remember that medical term. The important thing to remember is this. If you've started a new medication or you're taking several long-term prescriptions and your dry mouth has gradually become worse, it's worth asking your doctor or pharmacist whether your medicines could be contributing. Please don't stop taking any prescribed medication on your own. Many medications are essential for your health, but your healthcare provider may be able to adjust the dose, change the timing, or recommend an alternative if appropriate. The goal is to manage both your underlying condition and your quality of life. Warning sign number 3. You're sleeping with your mouth open. Here's a cause that many people never consider. You may simply be breathing through your mouth while you sleep. When you breathe through your nose, the air is naturally warmed and humidified before it reaches your lungs. But when you breathe through your mouth for hours during the night, moisture evaporates much more quickly. The result? You wake up feeling like your mouth has turned into sandpaper. There are many reasons this can happen. A blocked nose from allergies, a lingering cold, a deviated nasal septum, certain sleeping positions, or even dentures that make it difficult to keep your mouth comfortably closed. I remember a patient named Helen who was convinced she had a serious illness because her mouth felt painfully dry every morning. After asking a few more questions, I learned she had been struggling with nasal congestion for years. Her husband also mentioned that she slept with her mouth wide open almost every night. Once she addressed the congestion with her healthcare provider, her morning dryness improved dramatically. It's a good reminder that sometimes the smallest clues point us toward the real problem. So far, we've talked about dehydration, medications, and mouth breathing. These are all common causes of waking up with a dry mouth. But the next warning signs become much more important. One could point to a sleep disorder affecting millions of older adults. Another may be an early clue that your blood sugar isn't where it should be. And one is a condition that many people have never even heard of, but dentists often recognize it first. Let's take a closer look. We've already talked about 3 of the most common reasons you might wake up with a dry mouth. You may simply be dehydrated. Your medications could be reducing your saliva. Or you may be sleeping with your mouth open without even realizing it. But now we're moving into warning signs that deserve even closer attention. Because sometimes a dry mouth isn't the problem itself. It's one of the earliest clues that something else is happening inside your body. Warning sign number 4. It could be sleep apnea. Let me ask you a question. Has anyone ever told you that you snore loudly? Do you wake up feeling exhausted even after spending 8 hours in bed? Do you often have a morning headache? If so, your dry mouth may be pointing toward a sleep disorder called obstructive sleep apnea. Sleep apnea happens when your airway repeatedly becomes blocked during sleep. Each time this happens, your body briefly wakes itself just enough to start breathing again. Most people don't remember these tiny awakenings, but their sleep becomes fragmented all night long. Many people with sleep apnea breathe through their mouths while sleeping, especially during episodes of airway obstruction. That's one reason waking up with a dry mouth is so common among people with untreated sleep apnea. But here's what concerns me most. Sleep apnea isn't just about poor sleep. Over time, untreated sleep apnea has been associated with an increased risk of high blood pressure, heart disease, stroke, type 2 diabetes, memory problems. One of my patients, Michael, was 68. He came to see me because he thought something was wrong with his saliva. Every morning his mouth felt painfully dry. His wife quietly added, "Doctor, he snores so loudly that sometimes he suddenly stops breathing." That changed the entire conversation. A sleep study later confirmed severe sleep apnea. Once he began appropriate treatment, not only did his dry mouth improve, but he also had more energy during the day and his morning headaches became much less frequent. Sometimes dry mouth isn't the condition, it's the clue that leads us to the real diagnosis. Warning sign number 5. Your blood sugar may be higher than you realize. This is another condition many people never connect with a dry mouth. High blood sugar. When blood sugar stays elevated, your kidneys work harder to remove the excess glucose from your bloodstream. To do that, they produce more urine. The more fluid your body loses, the thirstier you become, and the drier your mouth can feel. For many people, waking up with a dry mouth isn't the only symptom. They may also notice drinking more water than usual, frequent trips to the bathroom, especially at night, blurred vision, fatigue, slow healing cuts, increased hunger. Now, these symptoms don't automatically mean you have diabetes. Many other conditions can cause similar problems. But if you've noticed several of these changes together, especially if they're new or getting worse, it's worth discussing them with your healthcare provider. I remember a patient named Susan. She kept a bottle of water beside her bed because she'd wake up every night with an unbearably dry mouth. She assumed it was simply part of getting older. During a routine checkup, her blood work revealed elevated blood sugar levels. Treating the underlying problem didn't just improve her blood sugar, it also reduced the constant thirst that had been waking her every night. Sometimes the symptom we notice first isn't where the real problem begins. Warning sign number 6. Your salivary glands may not be working properly. Most of us never think about our salivary glands. In fact, many people don't even know where they are. These small glands, located around your mouth and jaw, quietly produce saliva all day and all night. If they become damaged, blocked, inflamed, or simply don't work as well, saliva production can decrease significantly. This may happen for several reasons. Previous radiation treatment to the head or neck, certain infections, blocked salivary ducts, some chronic medical conditions, or simply changes that occur with aging in certain individuals. When saliva production drops, you may notice more than just dryness. Food may seem harder to swallow. Crackers or bread may feel like they get stuck. Speaking for long periods may become uncomfortable. Some people even notice that foods don't taste quite the same anymore. That's because saliva helps dissolve food molecules so your taste buds can detect flavor. Without enough saliva, meals can become less enjoyable. And when eating becomes difficult, some older adults begin eating less than they should. Over time, that may contribute to unwanted weight loss or poor nutrition. Your body depends on good nutrition to maintain muscle, support your immune system, and help you stay active as you age. That's why persistent dry mouth is never something you should simply learn to live with. If you're finding today's video helpful, I'd love to know where you're watching from. Leave your city or country in the comments below. It's always encouraging to see people from around the world learning how to stay healthier after 60. And if you enjoy practical, research-based health advice that's easy to understand, don't forget to subscribe and turn on notifications. Every week, we share simple strategies to help you stay healthier, stronger, and more independent as you age. We've covered 6 hidden warning signs so far, but the final 3 are perhaps the most surprising. One may be connected to acid reflux. Another involves an autoimmune condition that many people have never heard of. And the last warning sign is something your dentist may notice before you ever do, and it could have lasting consequences for your teeth and your overall health. Let's finish with the 3 warning signs that every adult over 60 should know about. We've already covered 6 possible reasons you might wake up with a dry mouth. Some are simple, some deserve medical attention. Now let's finish with the final 3 warning signs, because these are often the ones that surprise people the most. Warning sign number 7. Acid reflux may be playing a bigger role than you think. When people think about acid reflux, they usually imagine one symptom: heartburn, that burning feeling in the chest after eating. But reflux doesn't always feel like heartburn. In fact, some people experience what's called silent reflux, where stomach contents travel upward without causing the classic burning sensation. Instead, they may notice a dry mouth in the morning, a sore throat, frequent throat clearing, hoarseness, a chronic cough, a bitter or sour taste after waking. How are these connected? There are a few possible reasons. Some people with reflux breathe through their mouths during sleep because lying flat worsens their symptoms. Others wake up frequently during the night, which can disrupt normal saliva production. And in some cases, medications used to manage reflux may contribute to dry mouth as a side effect. It's important to remember that dry mouth alone does not mean you have reflux. But if you're also experiencing throat symptoms, frequent coughing, or that unpleasant sour taste in the morning, it's worth mentioning all of those symptoms to your healthcare provider. Treating the underlying cause, not just sipping more water, may provide much better relief. Warning sign number 8. An autoimmune condition could be affecting your saliva. Here's one that many people have never heard of, a condition called Sjögren syndrome. It's an autoimmune disease, which means the body's immune system mistakenly attacks its own healthy tissues. One of the main targets can be the salivary glands and tear glands. As a result, people often develop a very dry mouth, dry eyes, difficulty swallowing dry foods, a constant need to sip water, fatigue, joint pain. This condition is more common in women, especially after the age of 50, but it can affect anyone. Now, before anyone becomes worried, remember that Sjögren syndrome is far less common than dehydration, medication side effects, or mouth breathing. But if your dry mouth is severe, persistent, and accompanied by dry eyes or unexplained fatigue, it's something your doctor may want to evaluate. The earlier it's recognized, the sooner appropriate treatment and supportive care can begin. This is exactly why persistent symptoms deserve attention instead of being dismissed as just getting older. Warning sign number 9. Your teeth may be paying the price. Let's finish with one of the most important warning signs of all, your teeth. Most people think saliva simply keeps the mouth comfortable. In reality, it's one of the body's best natural defenses against tooth decay. Every time you eat, bacteria in your mouth produce acids. Those acids begin attacking the enamel that protects your teeth. Normally, saliva helps wash away food particles, neutralize those acids, and provide minerals that help repair tiny areas of damage before they become cavities. Think of saliva as your mouth's maintenance crew. It's constantly cleaning, repairing, and protecting. But when your mouth stays dry night after night, that maintenance crew can't do its job effectively. Over time, this can increase the risk of cavities, gum disease, bad breath, mouth sores, oral infections, difficulty wearing dentures comfortably. Your dentist may actually notice signs of chronic dry mouth before you do. That's why regular dental checkups become even more important as we age. One of my patients, David, came in because he was getting cavities despite brushing twice a day. His dentist noticed his mouth was unusually dry and suggested he discuss it with his doctor. That conversation eventually led to a review of his medications, several adjustments, and a significant improvement in his symptoms. Sometimes, the person who discovers the problem first isn't your physician. It's your dentist. What you can do starting tonight. The good news is that there are several simple steps that may help reduce dry mouth while you work with your healthcare provider to identify the underlying cause. I call this the 5-step dry mouth check. Check. Step 1. Stay hydrated throughout the day. Rather than drinking large amounts of water right before bed, aim for steady hydration throughout the day. This supports your body's overall fluid balance without increasing nighttime trips to the bathroom. Step 2. Review your medications. If your dry mouth started after beginning a new medication, or if you're taking several long-term prescriptions, ask your doctor or pharmacist whether they could be contributing. Never stop a prescribed medication on your own. Often, there are safe adjustments that can be made if needed. Step 3. Choose alcohol-free oral care products. Some mouthwashes contain alcohol, which can actually make dryness worse. Look for products specifically designed for dry mouth, especially alcohol-free rinses. Many dentists also recommend xylitol-containing gum or lozenges during the day to help stimulate saliva production, if they're appropriate for you. Step 4. Ask someone if you snore. This might sound simple, but it's incredibly helpful. If your spouse, partner, or family member says you snore loudly, gasp for air, or stop breathing during sleep, don't ignore it. Those clues may point towards sleep apnea, which deserves medical evaluation. Step 5. Pay attention to patterns. Ask yourself, is your mouth dry only in the morning or all day long? Does it happen after certain medications? Is it worse during allergy season? Keeping a simple diary for a week can provide valuable information for your doctor. Small details often lead to important answers. When should you see your doctor? Occasional dry mouth after a hot day or a poor night's sleep usually isn't a cause for concern. But you should arrange a medical evaluation if your dry mouth lasts for several weeks, keeps waking you at night, makes swallowing difficult, causes frequent mouth sores, leads to repeated cavities or gum problems, occurs with excessive thirst or frequent urination, happens alongside loud snoring and daytime sleepiness, is accompanied by unexplained weight loss, persistent fatigue, or swollen salivary glands. These symptoms don't necessarily mean something serious is wrong, but they do mean it's time for a proper assessment. Let's review today's 9 hidden warning signs. Today we discussed 9 possible reasons you might wake up with a dry mouth. Dehydration, medication side effects, sleeping with your mouth open, sleep apnea, high blood sugar, problems affecting your salivary glands, acid reflux, autoimmune conditions such as Sjögren syndrome, damage to your teeth and oral health. Remember, a dry mouth is not a diagnosis, it's a symptom, and symptoms are your body's way of asking you to pay attention. One thing I've learned after caring for older adults for many years is this: your body rarely shouts first, it whispers. A little more fatigue, a little more thirst, a little more dryness than usual. These quiet changes are easy to ignore because they don't seem urgent. But sometimes they're the first clues that your body needs a little extra attention. Listening to those whispers doesn't mean expecting the worst. It means giving yourself the opportunity to discover a problem early, when it's often easier to manage. Healthy aging isn't about avoiding every health issue. It's about recognizing changes, asking questions, and taking action before small problems become bigger ones. If you found today's video helpful, I'd love to hear from you. Do you ever wake up with a dry mouth? Which of today's warning signs surprised you the most? Share your experience in the comments below. Your story might help someone else realize they should speak with their doctor. And if you enjoy practical, research-based health advice for adults over 60, don't forget to like this video, subscribe to the channel, and turn on notifications. Here on Dr. Richard, we're dedicated to helping you stay healthier, stronger, and more independent, one simple habit at a time. Thank you so much for watching. Take care of yourself, stay healthy, and I'll see you in the next video. Medical disclaimer. This video is intended for educational purposes only and should not replace professional medical advice, diagnosis, or treatment. Dry mouth can have many different causes, and only a qualified healthcare professional can determine the reason for your symptoms. If you experience persistent dry mouth, difficulty swallowing, mouth sores, unexplained weight loss, severe fatigue, or signs of sleep apnea or uncontrolled diabetes, consult your doctor promptly. Never stop or change prescribed medications without first discussing them with your healthcare provider.